start by introducing myself. So I'm Marina Schwanke. I'm a first year PT student at UW La Crosse. And then for the APTA Oncology Student and New Professional Subcommittee, I'm the social media project director. So I'll kind of be facilitating tonight and asking Kelly questions throughout. I wanted to give a thank you before we get started to Eileen for helping with behind the scenes work and getting this planned. Really appreciate all of her help, as well as Rachel for kind of getting the word out on social media. So without further ado, I'll introduce Kelly and then we can get started. So Kelly Sturm is a board certified oncology clinical specialist. She has a CLT LANA certification and is a women's health specialist. You may know her as Cancer Rehab PT on Instagram and YouTube, platforms that she uses to educate both patients and providers. I'm very excited to have her join us tonight and tell us about her story in Oncology Rehab.
Awesome. Thanks for having me.
Yeah, thanks for joining us. So to get started, we'll just start with, where did you go to PT school? How long have you been out and where are you at now?
Yeah, so I graduated from the Mayo Clinic School of Health Sciences in 2013, so about 9 years ago. And I currently live a little bit south of the Twin Cities, St. Paul, Minnesota area. And I currently work in an outpatient setting, just treating oncology, lymphedema, and then women's health.
Cool. I might be a little bit biased, but I think Minnesota is like the best state. Right now, I'm just on the wrong side of the Mississippi River.
Except for when it's cold out, then we're not the best, but
right. Just a couple months.
Yeah.
Okay, so sounds good. So going way back, how did you decide to go into PT?
Going into PT, yeah, absolutely. I feel like I remember wanting to go into PT back in high school, and I don't really know a reason why. I shadowed PT, I shadowed OT, I shadowed pharmacy, PAs. I think I shadowed a little bit everything in healthcare. But the reason I really liked PT is because we are able to work with individuals over a longer period of time, generally. And I really liked that aspect that we get to kind of be a part of their process or their journey or whatever we want to call it. Rather than, at a pharmacy, you're just seeing them usually once in a blue moon, you barely get to know them. PT, we were just so much more involved. So that's something I enjoyed. And so in college, I decided to go pre-PT. And then I don't think I ever switched. I don't think I ever looked back. I will say, I'm fast forwarding a little bit, but when I went into PT school, I originally wanted to do neuro. I always thought I would do neuro. I did start in neuro, but I did not always want to do oncology.
Okay. Yeah, that was kind of my next question, was in PT school, so you wanted to go into neuro. So then after you started your career, how did you end up making that switch?
Yeah. And so this actually probably fits for everyone listening to this, or at least that are in school right now. I think at Mayo, we had 7 long clinicals at the time. I don't know what it is now. And we had, the standard acute care outpatient, kind of one of everything. And then we had a couple that we could do whatever. And so I just tried to get a couple neuro ones, which I did, and they were great. But a lot of PT schools are now starting to get a little bit more oncology into the curriculum. I did not have an oncology class. We had a lymphedema, 2-day class. And then oncology was spoken about here or there. So I didn't really have any exposure. I didn't even know that it really existed, to be honest. But on my acute care clinical, I had a week, not even a week, maybe 2 days that I was able to follow along the therapist who was by herself doing the breast cancer and lymphedema in the acute care setting. And that's Jenny Brott. She is an APTA member, an active one, I should say. And I enjoyed it. It was fun. It was different. Never seen anything like it. So that was my exposure But neuro was my thing. So I graduated and I got a job right away in an outpatient neuro setting, which was, at the time my dream job. I was so excited. Large hospital-based outpatient. And oncology came about because about a year into working, my first year, they wanted to expand our cancer rehab and lymphedema program that we have throughout the entire system to our site. We didn't have one at our site. And so they're asked if anyone wanted to be interested to go get trained in. And I, new therapist, excited to do new things or try to jump in new ways. I was like, okay, I had that 2-day stint that I was like, that was really interesting. I thought that was fun. I'll try it. And so at the time, STAR certifications were a thing, which is no longer there, but it was a training that hospitals or teams could do to get oncology certified. And then I went to close training for lymphedema. And yeah, I started treating oncology or cancer rehab and lymphedema, and I just absolutely fell in love with it after the first 6 months. I saw a great deal of need. I feel like this area was missing. There was a void for this population. And I, like I said, I absolutely fell in love with it. So I kind of did both neuro and oncology and lymphedema for another year or so. And then an opportunity came up for me to just do full-time cancer rehab and lymphedema. And so that's what I do now. So never thought I'd do that. Graduated, did not think I would be doing this at all. It just kind of fell into place for me. So I guess that's my plug for just take advantage of anything you guys possibly can see on your clinical rotations. You never know what ends up being in your career, and completely changed my career.
Yeah, that's super cool. So what about like the oncology rehab setting, what was it about that you enjoyed? Like what made you like, I'm all about this?
Yeah, to make a long story short, my grandfather had polio and had post polio, and I think that was the reason I actually wanted to be a PT, is because I saw him struggle to find someone who knew how to help. And for so long, it was more like, okay, you have this, there's nothing we can do. You're just gonna have to live with it. It's the new normal. And that, frustrated me as a family member. And I saw that similar thing with this population, that there was this void missing. Some of them had pain and tightness or the lymphedema and all the discomfort for years sometimes. And it was they were just told that this is the new normal. And knowing what we know as PTs in cancer rehab, that's not true. And so I think I found that voice that I think I wanted to be for my grandfather. And so I think that really drove a lot of my passion for really falling in love with this population, and just being more involved in advocating for cancer rehab.
That's awesome. So since you were kind of like one of the first ones who started the oncology rehab portion of where you work, how like was that an intimidating thing to take on? Like how did you manage that, I guess?
Yeah. So when I first started, I was lucky, I will say, when it comes to cancer rehab, that we had an established program for the most part. We had a PM&R physiatry provider who is a massive advocate for cancer rehab. She was a PT by background, went back to med school. And she was very loud in the oncology world about cancer rehab. And so she was very helpful in encouraging us and giving us as many resources we possibly could. So that was helpful, but it was intimidating. I would say that even though I was sent to get a certification, again, which no longer exists, but even though I had that, I still did not feel comfortable treating this population. I don't feel like I got a lot out of school with this, but B, the training was very medical based. It wasn't very therapy based. And as you all know, we hear a lot of, cancer is a contraindication. Cancer, there's precautions to this. And we don't get to think about the impairment and the functional limitation piece of it. And so it's something I had to learn over time, and I had to gain confidence. And I will say the biggest help were my patients giving me feedback. And so it was a few year process till I feel like I felt, comfortable and confident to really treat this population, and really take it to the next step and think of out of the box ideas, and just be what I felt like was a good therapist for them. I will say now I we have 90 therapists between PT, OT, and speech. We are a large program now. I am now the co-chair for the program. So I'm basically the therapy lead for the program. So I get to do a lot of the educating of all the new therapists, onboarding to be a cancer rehab PT. I get to help make some decisions, which is great. And so I think what I'm trying to do is really make sure that the therapists feel confident that they have the clinical skills to treat this population, no matter what kind of education they got in school about it. You know how to treat this. You just have to think of it in a little bit different way and apply it in a little bit different way. So that's something that I really hope going forward that schools do, but also that hopefully we can provide kind of the next wave of cancer rehab therapists to feel more confident with.
Yeah, so as you're like training those new clinicians, like is it more of like a mentorship type of thing or like a specific like you're training them on some sort of curriculum or like what does that look like?
Yeah, so trying to revamp it right now because I just took this role about a year ago. And like I said, it was very medical based. So we do actually use MedBridge. They've got some Nicole Stouts on there. They've got a few, I know there's some new ones coming, good cancer rehab courses that someone can take. So we have them watch those to learn about the side effects of treatment, the side effects of chemo, side effects of radiation, and then taking those and applying it into your own PT clinical mind of how you treat it. You know how to treat all of this. It's just how to apply that in your brain. So my job is to then sit down with each of them and go through cases and go through just some of that general education on, okay, you would do this with this population, you can do the same thing with this population, these are the only safety things you need to think about, but here's where the research is on what the best exercises are, just to help guide them. I really want therapists, students and therapists to know that they are skilled to treat this population right away, as long as you have a general understanding of how to apply what side effects and functional limitations you see, and then just have in mind some of the safety components. So, and then I'll follow them for or support them in any way through a few months at least to check in with them before they kind of probably feel confident on their own. So a little bit of everything.
Okay, that sounds awesome. So kind of going back to something that you had mentioned earlier. So your initial background, like as a neurotherapist, do you feel like that kind of like that skill set has helped you as an oncology PT?
I think so. I think anyone who's had their neuro clinicals, it's a complex group. It's a complex population. You have to truly look at their function. You have to look at impairments. Every stroke, TBI, spinal cord, they're all a little different. It's not just like they had a knee replacement and you have a protocol. You have things that you're looking at on their function. And the same thing is with cancer rehab. There are a couple things we're thinking about based on their treatment, but you kind of forced to think outside the box a lot of the times. So I thought it prepared me really well. Think of brain tumors, spinal cord tumors, the neuro population with that. They present in a somewhat similar way. And so I'm using a lot of those same interventions as well. And so definitely when you're on your neuro clinical rotations, I think you can use a lot of that, that kind of carries over to an oncology setting.
I think it's cool now how, at least in my program, they're kind of emphasizing how everything like blends together. Like you're not just an ortho PT, you're not just neuro, like you're not just an oncology PT, like all of those things blend together. So that's really cool.
Yeah, absolutely.
for you, like, what does a typical day look like?
Mhm. Yeah, so like I said, I have an administrative role partly now. That actually used to be, a half day a week or something, but now it's part-time. It's 15 to 20 hours a week. So my schedule is a little different probably than a typical therapist. I treat at least 3 to 4 days a week, just at least part-time. And so I treat only oncology, lymphedema, and pelvic health right now. So I maybe have 1 or 2 evals a day, a lot of follow-ups. We have a post-op breast cancer program really set in place with our Cancer Institute. So we get a lot of post-op breast that we do lymphedema measurements and risk reduction and kind of that prospective surveillance piece. But then we see any cancer. So I'll have a lot of that lymphedema. It could be secondary lymphedema, from cancer, or I will also see primary lymphedema or even lipedema sometimes. So a little bit of that. And then my other role is a lot of training. Like I have 2 presentations and trainings I have to prepare for the next week for, 3 new PTs who are onboarding. And then I have speaking to all 90 therapists in a couple weeks, just updating on research, updating on interventions, just trying to keep everyone up to speed and feeling confident. So I get a little bit of both, which is nice. I really enjoy educating. Got my platforms. I love educating. And so I'm glad I get to educate patients, and I'm glad I get to educate providers.
So, like, educating on your, like, YouTube platform, how did you start that, and did you expect it to, like, take off like it has?
No. Um, so I think again, I just saw this void. And I think everyone can probably see it. There are, I can't remember, Scott might know this, 17,000 or 7,000, oh my goodness, 17 million cancer survivors as of 2019, and obviously expected to grow by the millions over the next handful of years. So there's a massive number, but there is very few, if not no one out there supporting them. I had one individual that actually 2 probably, that pushed me over the edge to be like, okay, I need to figure out how to get to more people. I had one individual who came to me from, I want to say like Utah or something out west, and I'm in Minnesota. She just came because she had a family member here and heard we had some sort of program, didn't know anything else. She came in with a nice, very swollen arm, breast cancer 5 years ago. Right off the bat, you walk in and you instantly know it's like stage 3 lymphedema. It's very severe. But she had never heard of the term lymphedema until I said that day. And that, I think, my jaw dropped, which is probably not the most professional, but I was so shocked that you could go 5 years with follow-ups from oncologists and medical teams and doctors, and no one could tell you had lymphedema when it was probably one of the most significant cases I had seen in a long time. So I was like, there's something missing. How are we missing education? Doctors don't, some oncologists are fantastic and they know, but a lot of them don't, but they don't get the training. And so how do we get out and just educate? If I can't get to all the doctors, which I can't, then maybe I can get to the patients so they can say, oh, I have that. And then ask a doctor about it or try to find someone who can help. So that one person in particular, a couple of years ago, kind of edged me to figure it out. And I will say I started on Instagram. I don't remember my first post, but just really simple posts. And I had major imposter syndrome, major. I would post it, shut my phone off, close it, and not look at anything for the longest time. My family didn't know I was doing it. I didn't even tell my husband I was doing it. I was so like in a shell about it because I don't know why I was so anxious about it. So I did that for a while, then it started to pick up, tried to get a little more comfortable with it. And then I think, I don't know, after maybe 6 months, maybe a year on Instagram, maybe 1,000 people, which is great. I realized I was trying to share more. I realized people were asking questions. I want to know more about A, B, or C, and I needed more space. I needed more, Instagram's too short for me. So then I was like, hey, well, I'm gonna make a video and put it on YouTube. And then same thing, just don't tell too many people about it at first. And then COVID hit. And so I was like, okay, well, my patients need to know self MLD, whatever people are asking about it. So I just made those videos, and just try to keep thinking of things that people would need to know and figure out how to do for themselves during this time. And it just kept growing. So I just kept making videos. And so that's where we are now. Again, I just enjoy it. I try to find a balance because it is a lot of work. It's a lot of time. But when you have a passion for educating in any way or shape or form, it's really fun for me. I actually, like, people like, what are your hobbies? I'm kind of like, actually, I kind of like creating content. That's kind of my hobby. So
That's super cool. Yeah, I was gonna ask, like, how do you balance that with all of the things you have, like, at work, and then obviously personal life and all of that? Like, how do you,
yeah,
like, make
yeah,
time for all of it?
it's hard. I'll tell you that. I work lots of hours in a week based on the two things. However, at the end of the day, like I said, I really enjoy the content piece. It's not, I never like, oh, I got to go make something. 99.9% of the time, it's like, I actually just really enjoy it. So just downtime at home, I haven't turned on a TV in, like, I don't know, a year and a half, maybe. I can count on one hand how many times I've turned on the TV. So I don't watch TV. I don't watch Netflix. I'm very out of the loop on anything popular right now. Socially not there, but it's just a passion. I just enjoy it. So at some point, I'll probably have to make some decisions, but at the end of the day, I just have to decide what fulfills me the most and go that route.
That makes sense. Um, I was gonna ask something. I forgot. Um, what was it? Something about your YouTube channel. Oh, like, how has that changed your like, how you practice as a clinician? Because obviously, since you have all these videos, like, instead of just giving people like a sheet with pictures on, like, you can show them these videos. Like, is that something you utilize a lot?
I actually don't. So
Okay.
because I have my own LLC, and that's a hospital base, I actually have to keep them separate. So no, I
Okay.
don't say anything. That being said, the doctor I work with does tell everyone about it. So um, everyone figures it out pretty quickly. But no, I actually keep them separate. Some of my patients will come into me after I've been working with them and was like, "This was you." I'm like, "I know you. I've seen that." And I was like, "Oh, yep, that's me." So I usually feel like I turn bright red when that happens. But yeah, they are separate, but again, I get a little bit of everything, so it's good.
Okay, cool. Well, I'm sure it's helpful for other clinicians as well to just be
Yeah,
able to refer to
yeah.
those videos.
I hope that
Or
is.
helpful for
Yeah.
students too. Um, for you, like, if you could go back to when you were in PT school, is there anything that you would have changed? Like, obviously now you know that you're in kind of a different field, not field, but I mean a different avenue than what you thought. So is there anything you would have changed as a student?
I would say I don't think that I would change. I should have, I would taken my own advice. There was a clinical that I did not choose. I was kind of given it for whatever reason. It was not what I was interested in. I was almost confused why I got assigned to it. And I think I was a little frustrated about it, which I wish, if in retrospect, I should have, um, which I ended up doing, but gone in with them like, okay, you're going to learn something from everything you do. Every clinical you have, you're going to take away, and you will use a piece of every clinical in your career. I can guarantee that. And so I think if I would have gone in with that attitude, I think I would have tried to get more out of that clinical. It was a, a school a school resident program. It was something really interesting. These individuals lived there with developmental delay, and it was great for a portion of neuro. But I think I would have used a lot more skills if I would have gone in with a little bit more openness. So I did. I learned a lot, and it kind of turned halfway through, and I realized I was learning a lot. But I think if I were to go back and just tell myself something different, it'd be like, just make sure that you take advantage of, your entire clinicals and go in with a really open mind. Because again, 1-2 days of something on a clinical could alter your career. So probably the only thing that I would tell my past self.
As far as like in your career, what do you think has been like the best thing that you've done to make you a better like clinician?
Yeah, hands down, taking and sitting for the oncology clinical specialty exam has thus far been the best thing I've done. Taking a chance and saying, "Oh yeah, I'll try doing the certifications." That absolutely changed my career. Saying yes on a clinical changed my career. But as a clinician, studying for that exam, it always like, especially when you've been out of school. I was out of school 6 years, I think, when I took it. It's exhausting to try to think studying for something. And at that time, Scott was with me on that one. We were the first ones taking that, and I had no guidance. We had a cheat sheet to look at articles, but I had no idea what to expect. I feel like, I wasn't sure. So I studied for like 9 months straight for that exam, like probably harder than I studied for the boards. But test went great, passed with flying colors, but at the same time, I learned a lot. And so that was the best thing. And having that specialty has given me this opportunity with my job. It's taught me a lot to be able to educate on the platforms, educate other therapists. And so when someone gets to that point, I know it'll be a little bit down the road unless you're doing a residency. I would highly, highly recommend doing it. Not even just for the certification to have that title, but also for that learning opportunity.
Awesome. I think Scott just said something in the chat.
Yeah, so Scott said the board certification gives some clout when talking to oncologists to earn the respect and trust to refer to us. I would agree. Most of them don't know what that means. Like, what does a board certified oncology clinical specialist mean? But you see board certified, it does help a lot, and just shows that you have put in extra time, and you have extra skills in that setting, and so you do know how to help and what to do with this population. Definitely.
Yeah. So for people who might be watching that don't know, like what are the requirements to be able to sit for that exam?
Yes, I actually had to look this up yesterday, so I hope I remember this. If you have to have 2,000 direct patient care hours within the last 10 years, or 500 of those have to be in the last 3. And so if you work moderately full-time or part-time in oncology, you can, that actually comes fairly quick. You have to do a case report on a patient case that is semi-recent and go through and kind of show your knowledge and skills on how to treat and help these patients. And then if you are approved, you have to do that first and then get approval to sit for the exam. That I think is it, unless you do the residency. So if you do the residency, I don't believe you have to do all 2,000 hours prior. You can sit for the exam after. I'm actually not sure if they have to still do the case report. I would guess they actually do, but I'm not sure. So.
Okay. Thanks for that. Scott says he thinks so.
Yeah, I think so. It makes sense. Yeah.
Okay. What is the best piece of advice that you have received that is PT related? And then after that, what's the best piece of advice you've received that is not PT related?
Oh, those are good questions. These are always so tough for me because there's so much. I'm trying to think the best PT advice I received. I think not really, not like the things that like fake it till you make it, like that kind of stuff. Like it's not probably really helpful, but I think the biggest thing is just I needed a lot of confidence. I think I was a little timid coming out of PT school. I did well. I felt like I knew what I was talking about, but I was still uncertain as a new grad. And so I had kind of clinical mentor in a way, who, when I started, she would kind of meet with me once a week and make sure that how I was doing and check in and see if she could help. And she just kept giving me the same thing that I've probably been saying today, is like, you have the skills, you know what you're talking about. You graduated, you went through this, you know what you're doing. Just take a step back and think about it a little bit. And I think that rather than like a piece of advice, it was more the encouragement, and just to know that, you guys have put in the work for 3 years or however long your program is. And you are capable of treating this population and all populations and all patients. So I would say that was something that I've probably taken away or with me, and that I feel like I try to push forward as well. I would say non-PT, and this would probably be in the oncology related setting. I have a friend who I went to high school with who had breast cancer, must have been 4 years ago now. This is kind of when I was starting on Instagram. I met her for coffee and we were talking about it, and she gave me, all she said to me was, that her goal, because she was starting the Breasties program, if you guys are familiar with that, for the Minnesota chapter, and she just said, she's just trying to meet everyone where they're at. And so some individuals going through their cancer treatment, they're angry and they get short and they get frustrated. Some, are going to cry, they're upset. Some are hopeful and they're ready to dive into doing a lot of advocating and signing up for all the events and things. But that a reminder is just that, everyone is correct in what they feel. Everyone's opinions, everyone's feelings, everyone's emotions on how they are responding to their diagnosis and their process and their treatment and the changes in their life are valid. And that I took a lot from that, because I feel like that gave me a lot for being a therapist. That, some patients, I think a lot of people have had them, that, they're challenging to work with because they're really abrupt and they're really short, and they can be kind of harsh back at you when you're just trying to help, and like, don't yell at me kind of thing. But I just try to take that same thing that she told me every day into my patients, that their feelings are valid. If they're angry and they want to get angry at me, I completely understand, and that's completely valid, because that's, their feelings are valid based on what their situation is. And so I'm going to try to cheer when they want to cheer. And if they want to, vent, I'll listen if they want to listen or vent. And if they're going to cry, I always have Kleenex next to me. So, and I'll just sit and listen, or, sit and be there. And so I think that was the best advice I've gotten. That's kind of non-PT, but then carries over definitely into my day-to-day.
Yeah, that's really good advice. So this is going back because you are like a women's specialist. So how did that come about? Was it just because you were mostly seeing individuals with breast cancer, or how did you get into that?
Yeah, so I added pelvic health because I was getting the gynecological cancers, that realm pretty often. And I felt like I was missing something, and I just wanted to be an all around good oncology cancer rehab therapist. And so I felt like that was a missing piece. Yes, we have a wonderful pelvic health program, but I feel like I was seeing them so much that I felt like I could try to help. So I took Herman and Wallace's course. I know a lot of people are probably familiar with those. I've just taken 2. I haven't done all 4. And right now I've only done the women's. I haven't gone back and done the men's. Definitely something I hope to do in the next year or 2. But yeah, I did that. I do treat all pelvic health now, or women's pelvic health, I should say. So just the standard postpartum, incontinence, pelvic pain. I do a little bit of that as well. But yeah, I definitely went into it originally to try to help support my oncology population.
Yeah, you're definitely a very well-rounded therapist. You have all sorts of training.
I know. Except I don't remember how to, I don't remember, I shouldn't say don't remember. I haven't done any low back pain in a very long, like true low back pain in a really long time. So I probably am not a great orthopedic therapist right now.
That's okay. You have a lot of other things going for you.
Right.
So, so for your job, like what would you say is your favorite part of what you do? And then on the other side of that, not your least favorite, but what's the most difficult part of your job?
I mean, instantly my first thought of difficult is insurance, but I know that's probably like cliche to say, but it's true. Um, my favorite part is hands down, obviously the patients. I absolutely love my patients. I love working with them. I love educating them, empowering them, giving them knowledge, giving them tools. Couldn't tell you how many times in the oncology world you hear like, why didn't I know about this sooner? Like, oh my goodness, how did I not know about this sooner? Um, I go into another story. I had a patient maybe about 5 years ago come to me 39 years, I think, 39 years out of her breast cancer treatment. And 39 years ago, radiation was very different and surgery was very different. It was not as great, not as controlled. So her, radiation fibrosis, her tightness, her scar tissue, it was pretty bad. I don't think she had more than 100, like 90 to 100 degrees of flexion of their shoulder, but for that many years. And she had a lot of pain, of course. And she had never had therapy, nor did she even know it was a thing. Again, she was just kind of told that's your new normal. And so, I treated her a little bit longer than I would normally treat someone. It maybe took 2 months. It usually only takes a couple weeks to get someone really making progress. But she probably got up to like, I would guess like 130 degrees, like a lot more functional. But her pain significantly dropped down. And I just remember her just being absolutely in tears of, she was so grateful. But it's very much one of those things of, why didn't I know about that sooner? How did I go through over half my life with all of these side effects, and no one was able to help me till now? And so that's my favorite part, those kind of things. And then my least favorite part, I hate to say it, but it's the insurance part. um I could say that, oncology is tough. You do treat stage 4, you do treat hospice, and there are some really tough recurrences that I see a lot of. Those are really tough moments, those are really tough days. But as a therapist, you get the opportunity to give them quality of life in some way. You get an option to give them some hope in some situations, and try to help, in positive ways. So that I still feel like that in some ways is a positive. The problem with insurance stuff is, lymphedema garments aren't covered if you have Medicare, and you can't get pumps rarely anymore. And a couple insurances aren't even paying for compression bras now, or compression sleeves, if they're at risk for lymphedema. And so you have these patients who just went through all of this stuff, and now they have to pay out of pocket because they're at a high risk for lymphedema and whatever. And that part's just my frustrating part. So along with advocating to doctors and providers and surgeons on what we do, I think another area we need to focus on is advocating to insurance companies, and just, government areas and that kind of thing, legislation, because that's definitely a need going forward.
Yeah, definitely another reason why like getting involved in APT oncology is so important, to advocate for our patients. Um, and also, yeah, it's just really cool to see the impact that we get to have in patients' lives. Um, before I have one more question for you, but before we go into that, do you have anything else you'd like to add or like tell us about your story?
Um, I guess to say, like, I think I've shared a lot. Like, I think I've said this a couple times already, but just take advantage of your clinical experiences. Take advantage of your first jobs. When things pop up or opportunities, you can't say yes to everything. Absolutely not. But just take little things here or there, and try new things, and who knows, your career completely different than you thought it would be. I think the other thing is, oncology is growing fast, which is really exciting. A lot of new research, but there still lacks a lot of education, a lot of training out there. And so utilize the mentor program. I know the APT oncology team does. I don't know that I had that when I was there. I didn't know it existed. So that'd be really beneficial. I know there's not a lot of courses. I will say sneak peek, there is, working with Elise Cantu of the Onco PT, the podcast, I'm sure everyone knows. And we're going to try to change that. So you can be on the lookout for that. I do have a link if someone wants it to kind of sign up or watch for that. But yeah, just take advantage of the mentorship program as well, because I feel like that's probably what I wish I would have had back when I was training in, definitely.
Awesome. Thanks for that last piece of advice. And also looking forward to the collab with you and Elise. That should be very good.
It's very fun. She's super fun. We've had a lot of fun so far.
You guys are kind of like leading the way in the APTI oncology, like social media aspect of things. So that's super cool.
Yeah.
Yeah, so my last question was just like, what advice would you leave with students, or even practicing clinicians who might have like a little inkling of interest or even like a large interest in oncology PT, which you kind of addressed that already, but if you have anything else to say, feel free.
Yeah, absolutely. I think I've shared a lot of as much as I can. Hopefully, some of the stuff that we do on our platforms, Scott on Twitter shares a lot of research, which is wonderful. Just kind of soak in, these individuals who have kind of are ahead of you a little bit, because that's all I'm doing. I look up to Scott a lot. I look up to Nicole Stout a lot. Susan Maltzer has been doing some stuff too. So do that. But again, if you feel like you're missing education, you're missing training, do the mentorship program, kind of get that one-on-one so you can bounce, cases off at someone or get guidance on that way. If you want more, we hope there will be a course very, very, very soon. So we'll announce that too. So more opportunities. So they're going to be out there, but definitely reach out and look around and ask around. This is the well, I am definitely biased, but the oncology section is hands down the best, because it's a smaller group, but it's a really tight knit group, and very, very supportive group. So.
Well, thank you so much for sharing your story with us and answering these questions. Now I'll open it up to if anyone else has questions for you, but yeah, thank you for sharing.
Yeah, absolutely. You guys can feel free to shoot me messages if you ever do. I am on social media, but I am slightly slow sometimes when it comes to DMs. I have a limit on my phone and it blocks me after 30 minutes. So that's how I try to find a balance. And so my email, I guess I'll type it in here. It's just cancerrehabpt@gmail is probably the easiest. I probably look at that one the most. So if you have a question, feel free to reach out. I'm happy to kind of talk through clinical things or career things, or can try to help social media things. Still learning, whatever you guys may need. So
thank you so much. And thanks to everyone for attending, and have a good rest of your night.
Thanks, everyone.